Did you know? Stroke is currently the second leading cause of deaths in the world. Around 6.8 million people died every year. Around 425,000 women died, and 370,000 men died per year, which leads to a difference of around 55,000 people died per year. The difference shows that stroke occurs more in women than men. Let's get to know about stroke. A stroke occurs when the supply of blood to the brain is suddenly disrupted. Blood is carried to the brain by blood vessels called arteries. There are two types of stroke: ischemic stroke and hemorrhagic stroke. The first ischemic stroke is caused by cholesterol plaque that grow in the arteries. It is formed by a process called atherosclerosis, which is hardening of the arteries. The plaque caused the narrowing in the artery and difficult for blood to go through. The second ischemic stroke is caused by a blood clot called embolus. Many emboli are broken down by the body and go away by themselves. However, if it doesn't break down and travels to the brain, it is called brain embolism. Another stroke is called hemorrhagic stroke. Hemorrhagic stroke occurs when a weakened blood vessel ruptures and bleeds into the surrounding brain. 80% of stroke cases that happen are ischemic stroke, and the other 20% are hemorrhagic stroke. Every year, the percentage of death caused by stroke keep on increasing higher and higher. Stroke is now also the major cause of deaths in several countries such as USA, Australia, and several Asian countries. Stroke usually happens to the elderly at age of 60 and above. Around 78% of stroke cases involve the elderly. However, nowadays age doesn't matter anymore for stroke to happen. 27% of stroke cases also involve the young adults at the age range of 25 to 59 years old. Also 4% for kids and teenager, age range of 10 to 24-year-old. And even the worse, 1% to newborn babies. Kids and even infants? Yes. How is it possible? Stroke in children are known as pediatric stroke. Stroke is different in children and newborns than it is in adults. Children have hemorrhagic strokes as often as they have ischemic strokes, while adults are more likely to have ischemic strokes. 60% of pediatric strokes occur in boys. Causes of stroke are also different in children than the adults. Common risk in children are acute or chronic head and neck disorder, infection, cardiac disorders, abnormal blood clothing, sickle cell disease, and disease of the arteries. While adults' risk are high blood pressure as the main factor, high cholesterol, cigarette smoking, poor diet and lack of exercise, obesity, drink too much alcohol, diabetes, and family stroke history, or TIA, stands for transient ischemic attack. There are several treatments to cure stroke, depending on the condition. The treatments for stroke are medical treatment, surgical treatment, and aneurysm treatment. We can cure stroke faster as soon as we can recognize the symptoms and act fast. Facial expression, arms, speech, and time. We can prevent stroke by lowering the risk. No smoking. No alcoholic drinks. Far from diabetes. Poor diet. And obesity. If we can prevent stroke before it's too late, why not?